How you guys doing? I want to talk about something here that's really important. Now we've all seen John Letterman interview on NBC News, and it did not go as well as what people thought. No. Now I talked about this last night, but I tried to upload to my channel, to one of my channels, but it didn't really go well. Um, but I want to do this. That this past May, John Finneman had a stroke, and it could be any members of your family: mother, father, grandfather, grandmother, aunt, uncle, brother, sister, cousin, anywhere in the family. Um, I want to read because a lot of the woke mob went after the reporter for doing her job, and the wife of John Finneman wants her punished for doing her job. So I want to read the um, I want to read the cause of a stroke. And okay, okay. I explain cryptogenetic stroke. Okay, the major of all strokes are ischemic, which means they occur as a result of a obstruction such as blood clot within a blood vessel. The blockage prevents or reduces the delivery of oxygen, essential nutrients to the brain. Okay. In some cases, despite testing during the hospital stay, the cause of stroke cannot be determined, but this is what known as a cryptogenetic stroke or a stroke of unknown cause. It's estimated that 25 to 30% of ischemic strokes are cryptogenetic or unexplained. Atrial fibrillation (AFib) is a major risk factor for stroke. It is a common condition in which the upper chamber of the heart very fast pump heartbeat very fast and irregularly as a result of blood is not pumped effectively to the rest of the body and may pull any clot or clot dislodges. It can travel to the brain and result in a stroke. People with AFib are 5 times more likely to have a stroke. Um, Having a stroke means you are at greater risk of having another recurrent stroke. At least 1 in 4 Americans who have a stroke will have another within their lifetime. Determining the cause of your stroke will help your physician take steps to minimize the risk of having a recurrent stroke. Now, what could be the cause of a cryptogenic stroke? Atrial fibrillation, AFib, increases the risk of stroke more than 5 times, but it often goes undetected since it can happen infrequently or without symptoms. Normal heartbeat. A small pulse and electric current spreads through quickly through the heart to make the muscle contract. Atrial fibrillation. In atrial fibrillation, the heart's upper chamber quivers faster than the rest of the heart. What happens when I experience atrial fibrillation? Symptoms: irregular heartbeats, thumping and pounding heartbeats, a feeling that the heart is racing, chest discomfort, fainting and lightheadedness, fatigue, shortness of breath, or weakness. However, some people have no symptoms and discover that they have AFib at the doctor's appointment. Manageable risk factors. Some factors can contribute to AFib can be controlled and modified, like managing high blood pressure or reduced alcohol consumption. Control risk factor includes high cholesterol, high blood pressure, heart disease, smoking, excessive weight, metabolic syndrome, stress, alcohol abuse, lack of exercise, some meditation, sleep apnea, thyroid disorders. Non-controllable risk factors: family history, advanced age, heart disorders from birth, gender, males are higher incidence of AFib. Heart monitors can unlock the answer. If the cause of your stroke is unknown, cryptogenic heart monitoring can be heartbeat may heart monitoring may be necessary to help determine if atrial fibrillation (AFib) is a factor. You may be asked to wear a portable heart monitor for several days to try to identify AFib, but in some cases, long-term options may be needed. A recent study shows that for many cryptogenic stroke patients, it could take more than 80 days for AFib to appear because the episodes happen infrequently, often without symptoms. With continuous long-term monitoring, your doctor can get information about your heart to help make a diagnosis and find the right answer for you. Talk with your doctor. These talking points will help you remember important information related to your symptoms to share with your healthcare team. Remember to share a description of your symptoms if applicable, the number of episodes you had in the past 2 years, when you were doing before you had the symptoms, any concerns you have, e.g., safety, your job, driving, any treatments you are receiving for your heart, if your family has history of heart conditions, how your symptoms are affecting your home and work life. Remember to ask, how will you determine if I have a heart condition? Well, the test will perform. Would long-term monitoring with a cerebral cardiac monitor lead to a faster diagnosis? What should I do when I experience symptoms? What should I be concerned about my symptoms? Will I need treatment? If so, what kind of treatment? What alternatives are there? Do I need to restrict my activities? treatment options. If it is determined that you have experienced episodes of atrial fibrillation (AFib), your doctor will recommend the most appropriate treatment to help prevent another stroke from occurring. These treatments may be used to help manage your AFib and prevent another stroke. Life changes. Make certain lifestyle changes may improve your overall heart health. Your healthcare team may recommend that you eat healthy foods, choose a low salt diet, exercise, stop smoking, limit alcohol intake. Medication. Medication may be prescribed to control your heart rate or rhythm. In addition, anticoagulant, blood thinners, drugs are aimed to prevent clots from forming that can lead to a stroke. Cardioversion. A procedure that A procedure called cardioversion may be used to reset the abnormal heart rhythm back to normal. Cardioversion is performed either with medication called antiarrhythmic, antiarrhythmics, or with a electric shock delivered to your heart when you are sedated. Catheter ablation. If medication or cardioversions don't work, or if you have a side effect, catheter ablation is another option. During catheter ablation, either radiofrequency energy or psychotherapy is direct through the catheter, inserting in the artery towards the bottom of electrical pathways in the heart tissue. Either method scars tissue and may normalize the erratic electrical signals to correct the arrhythmia. Pacemaker or implantable cardioverter defibrillator (ICD). A medical device like a pacemaker or an ICD can detect and treat AFib early and suppress onset AFib. That is Medtronic.com. You guys should check that out. And make sure you talk to your doctor about because John Letterman had a stroke, and it now just reading this is really important for everybody who have a member of their family that had strokes. Could be a family history of this very health issue and stuff like that. Now, my grandfather, he had a pacemaker put in his chest to monitor his heart, and because he had strokes, silent ones, small ones, but I don't know if he had a major stroke. He was in the hospital off and on throughout his life. That from what I've known, before he died, and it bothered me because I lost a grandfather. I lost my father lost two parents, and which kind of tore me up because I'm close to my grandparents on both sides of my family. My mom's parents and my dad's parents, and I became close to both my grandparents on both sides of my family. My mom's parents and my dad's parents, and my grandmother, my dad's mom, she died of kidney failure, and she went through dialysis 3 times a day. No, 3 times a week. Not a day, but a week, and it got pretty bad, and My grandfather, he had heart. He died of heart problem. His heart went out on him, and he was in hospice for a while. And my grandfather, my mom's father, passed away about 3.5 years ago. And it, it tore me up because I looked at I looked up to my grandparents because they've been through things you would imagine, and my grandfather, my mom's father, had heart issues, and he had a pacemaker put in, and stuff like that. And he started having strokes, and he had a few bad ones, but the men in his family, like my great grandfather, they never somehow in their family's history they never seemed to pass the age of 75 or in the mid 70s. They usually already be dead by pass away by that age. But my grandfather, he was going to be my grandmother's 88 years old. Just turned 88 last year. This year she'll be 80, 89. I think. I think she'll be 88. Just turned 88. But she's suffering of she's suffering with um, dementia and slight Alzheimer's, and she'll say a few things that kind of don't make any sense, but she is at the age now where she is suffering from onset dementia and also Alzheimer's. It's kind of a scary thing. Being at that age and your mind's going, it's scary, very, 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 very scary. And I would not wish that I would not wish that on anybody at all because it is scary. You not remembering. I mean, partially anything after a while. It is very, very scary. Um, but John Fetterman is running for Senate for the Senate seat in Pennsylvania. But a lot of people are attacking the reporter for doing their job. But yes, there's people with disabilities in office. You got a deaf mayor. You have a councilman in a wheelchair, someone in a wheelchair. But a stroke is not a disability. It's not. I don't know. I don't know if you could call it that. But I would have to look more into that myself personally. I think that, but but it's not looking good for John Fetterman if the woke left on Twitter is attacking the reporter because it's like it's making John Fetterman look really bad, really, 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 really bad. He is his poll numbers are dropping. Dr. Oz polls are rising a little bit. So I think that when you understand that, I mean, if you look at John Fetterman, he's not looking good. You know what I mean? Because a stroke is like a concussion in a way. Because after a concussion, it takes time to recover. Because if you look at I mean, Chris Nowinski, who used to work for the WWE, he became part of a team that investigated concussions because he got concussed during in a wrestling match, and whether you're in professional wrestling or football or baseball or hockey or any sport, and you hurt yourself, you hurt your head, you get hit in the head, and your brain bounces against the inside the cranium, you know, and it bounces, you know, kind of like a ball bouncing up against a wall. It does so much force, it does some damage, and because I know what it's like to have a concussion. It ain't fun. It's like you're dizzy, and you are like lightheaded. You feel like you like really wobbly, you know, very wobbly. But with a stroke, it's almost like that, but it takes time to recover. I mean, it happened in May, right? May of this year, and the doctors that said, look, it takes. I mean, the recovery is not that simple because the block of oxygen to the brain is devastating, you know, and just like really devastating because how many people that have suffered strokes compared to how many people suffered concussions, you know? That's a question that you need to understand that it's not easy to recover because the mind is, I mean, dude, not easy, man. It's not easy at all. It is like really, really devastating, man. And I would be careful if I was the woke mob left, man, because again, majority of them don't know what they're talking about. You know, you got one guy saying, you know, who cares if he has a stroke? He'll be fine. No, because it's not that simple. It ain't that simple because if you had a member of your family that had a stroke or a concussion, the recovery rate is not that simple. It takes time for your mind to recover because your mind is like the one part of your body uh, that needs to recover a lot longer than even the physical body, you know, because the mind, if you get hit in the head enough, you're done. You are done, man. You know. I know what it's like to get a concussion. It is not fun. It is devastating because you have to sit there and have to recover, and it takes time for you to even recover. I remember 30 years ago, I was 16 years old. I was hit by a car. I was hit by a car. Yeah. A 4,000-pound projectile hit me. And I was on a bike. And when I got back to school, I couldn't write. I could not pronounce my words. You know. So I was pretty fucked up. 16 years old, 30 years ago. 30 years ago, this past September 29th. I know what it's like to have my brain fucked up. I couldn't write. I couldn't put a thing together. My mind was fucked up. You know? I was thrown in the air like a fucking rag doll, man. And I thought I was dead. I thought I was dead. You know? And all I know was I was hit. I was out. I was out. After that, all I know was I was on a gurney. I was on a stretcher, about to be laid up in the hospital. I didn't know if I was going to live or not. My mind was fucked up. That was just 30 years ago. 1992, that was 30 years ago. And my mind was just, at time, much, really fucked up. You know? And I thought, you know, will I be the same again? You know, and there are some points that when you understand that anybody with a stroke, that had a stroke or a concussion, it takes a while for the brain to heal. It's not like, you know, if you get a cut in your hand or if you scrape your knee, it heals within a few days, you know, after a while. After it's put a little ointment, stuff like that, you know. But the mind takes longer to heal. It does. And whether you had a concussion or a stroke, it takes time for the mind to recover. It's not easy. So, I mean, it's like being in a car accident and you get hit in the head, dude. And you go head first through a windshield, dude. And like you managed to live, survive, you have a concussion. Your mind is fucked up after going through an accident, or you bump your head. You know, the pain's there, but it's gonna be a while for it to heal. You know, because I've been hit in the head many times in my lifetime. You know, and it hurt. I mean, it hurt. You know, so to anybody who attacked this reporter, I just want to say that you guys need to kind of back the fuck off, okay? Because none of you know what the hell you're talking about, okay? All you're doing is you're making it worse for John Fetterman and his campaign team, because the more you attack the reporter, you're making it way too easy for Dr. Oz and his campaign to do well in the polls. Now, if John Fetterman's campaign team would have had the doctor talk to the reporter and to get the update on John Fetterman's health, you know, it'd be a smart thing to do that. If, like, you know, Yeah, he suffered stroke, but he's recovering. But he's recovering well. Okay, but the still the mind has a while to heal. It needs time to heal though, because see May, June, July, August, September, October. That's 6 months ago. So if John Fetterman was smart, I mean his wife, they would really get another note from the doctor, you know. But the thing is, nothing's happening, and they're letting a guy who just had a stroke 6 months ago run. You know, and the thing is, you gotta think for a moment, guys. I mean, when you really understand what's happening here, is that the woke mob will take anybody who's doing their job into really getting down to the nitty gritty, you know, and it's not making anything better for John Fetterman and his campaign team, because it's actually making it really worse, attacking the reporter who are asking important questions. But even with even with the closed caption, okay, even if you could read it or not, it's not looking good for John Fetterman anyway, because it isn't. It looks like he needs to heal. His health needs to heal because, I mean, the guy had a stroke. Okay, imagine this guy running for Senate and not knowing what he's talking about. It's like Joe Biden, you know, because his mind's all cattywampus, you know, and it's because he is going to be in his 80s here pretty soon. He'll be like Ronald Reagan, the second oldest president in U.S. history. And between Reagan and Biden, we all know damn well that we're all going to vote for Ronald Reagan. You know, and but the thing is, it's not going to do well for John Fetterman. You know, if his wife would have uh, not attacked the reporter for doing her job, because if she was smart, she would ask the doctor to release somewhat they can of John Fetterman's mental health, because again, the guy had a stroke. So, and people want to know, will he be okay mentally to continue to run? Because that's one thing about a candidate, is that will they be able to mentally handle pressure? Because again, the mind needs to heal. You know, you can attack me all you want, but it does not change a fucking thing. Look, I don't care about the woke mob. I'm not afraid of the woke mob. I'm not afraid of the cancel culture mob. I don't care about that mob. Because all they are is no more than overgrown children having a simple temper tantrum. That's all it is. You know, I'm not afraid of the woke, and again, the cancel mob. I'm not afraid of them. I could care less about them. They're not my concern. They're no more than just children with a temper tantrum. But if they really want to understand John Fetterman's condition, look it up on Medtronic.com. Understand about the stroke. because the heart and mind are linked on so many levels, big time. You know. Okay. All right, folks. This is a good old Grimlock, and I did read. Did some reading here. Got some information. Medtronic.com, and you can look up anything medical you want to know about. Go to medtronic.com to get your information on the stroke, heart problems, anything that you want to know about any condition. All right. So, to all the woke mob and cancel mob, if you want to look up for yourself, medtronic.com or md.com. That would save your brain from being fried. Now, but the truth is, they're not going to stop. They're not going to stop. Because this woke ideology is a very dangerous cult. Big time. And it's fucking stupid. Alright guys, please share this video. And if you like this channel and new to this channel, please leave a like, subscribe, comment below, hit the bell for notification, and I'll see you guys next time. Always live healthy, happy, and wise. I love you guys. And I'll see you all in the next video. Peace out. Godspeed.